Please welcome Dr. Walid Albanna.
I am a Palestinian from the Gaza Strip and work as a neurosurgeon in Germany, where I currently live. Neuroscience is the inspiration for my work, which revolves around nerve cells and has taken me on a journey that has led me to the eye. It started with my doctoral thesis in the retina and continues with the development of the prototype NeuroCam. Well, in neurosurgery, the most critical emergency is the rupture of the brain aneurysm, which means a hemorrhage in the brain. Even after a 100% successful operation, we need to monitor the patient in our intensive care unit for at least 3 weeks. The blood that leaves the ruptured aneurysm can irritate brain vessels and can cause them to become narrow, a condition known as vasospasm. As a result, the brain can swell and the patient can suffer a stroke followed by another stroke. Such cases have a 30% mortality rate. To avoid a stroke, we need to monitor the brain in real time. And it is imperative that doctors detect vasospasm as soon as possible. To monitor the brain perfusion today, we have different techniques that use machines and devices known as TCD, transcranial Doppler, CT perfusion, and DSA, digital subtraction angiography. These are non-continuous measurements. And this, as you can see, is a continuous method with sensors placed in the skull permanently, which requires an additional invasive surgical procedure. It is said that the eyes are a window into the soul. Professor Malik told us about that. I don't know about that. But what about a window to the brain through the retina? That means, in other words, using the eye to study the brain. To elaborate, the retina is an embryological part of the brain and easy to access. And retinal vessel analysis is a well-established non-invasive diagnostic tool in ophthalmology, which enables a direct look at the retinal vessels. So I did clinical study in Germany using a huge camera, and I have found that you actually detect changes happening in the brain while just looking at the eye or the retina. As you can see, the camera was too big, and we were not able to run tests and measurements on patients in deep coma, which were much more important to us. I have been searching for a long time, working to make my dream of developing electronic glasses a reality. To that end, I made a trip to the USA to meet other researchers, but with limited success. Then, after intensive research on the internet, I came across the page of Stars of Science just 2 days before the deadline. Stars of Science inspires the young generation and can turn creative ideas into reality and encourage youth to reach their potential. So Stars of Science gave me the amazing opportunity to develop my innovation in a short time, and I was able to start making my dream a reality. And now we have this portable device as prototype NeuroCam with new features. This prototype is incredibly beneficial for both patients and medical professionals. For patients, it's life-saving, non-invasive, no radiation exposure, no transportation required. And for the hospital, it is low cost as a diagnostic tool because there is no need for sensors and no further surgeries are required. This is a portable device like a fundoscope. There are no cables and connects directly through Wi-Fi. Using tablets, we have a user-friendly interface. We have a fully automated vessel selection, and screening is doctor independent. The system is motorized. This portable device is not only for neuro diseases. The eye is very important for the rest of the body as well. And we may use this device to look for changes related to Alzheimer's disease, arterial hypertension, and diabetes. In the coming years, I think we will make this camera much smaller. And in the future, who knows, maybe we can transform this camera into an electronic contact lens and hopefully save many lives. My big thanks go to Stars of Science and Qatar Foundation. Thank you very much.
Thank you so much, Dr. Walid. So you have introduced a new phrase now. It's retinas are windows to the brain. I love the idea of simplifying stuff. Without someone like you, we wouldn't have iPads or laptops from huge computers. So I really understand what you're doing, and I wish you all the best.
Thank you so much.
And now it's time to ask Dr. Walid questions.